Gene therapy.
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 Gene
Gene
therapy.
therapy.
Gene therapy.
Gene therapy.
Gene therapy is the therapeutic delivery of nucleic acid into a patient's cells to treat a condition. It begins with the identification of a genetic mutation that is desired to be altered. Then, a specific coding DNA is developed to correct the mutation and is put into a viral vector, which is then transmitted into the patient. In ocular cases, it means injecting it into the eye.
In the Western world, the main problems are age-related macular degeneration, glaucoma, and diabetes. The eye was considered to be really sort of a safe environment to do this. It's small, it's isolated, you don't need to rescue very much tissue in order to get really a profound effect on vision. Not least of which is the fact that you can assay the outcome and ask the patient about the outcome, whereas it's harder to know exactly what your liver is doing, right? But you can certainly talk about your visual experiences. But now as the field is moving forward, the age of the people receiving the treatment is getting lower and lower. And I think the youngest patients at this point are about 3 years old. And so as safety becomes more and more assured, then the age of the patients can go lower and lower. And we have a long way to go, but this is a very good path that we seem to be on, beginning with genes that have simple genetic underpinnings that we can understand not only the gene structure itself, but the pathway, the whole area of metabolism that this gene is affecting, and then design approaches to try to fix that.
In the United States, it is estimated that there are between 3,000 and 7,000 people who are affected with inherited retinal degeneration. Some of them are elderly and are past the point where therapy would be helpful, while some of them are very young, making it difficult to detect what their genetic condition is. Saying that we can treat all of these people in the near future is not necessarily realistic.
We sent a Google survey with these questions out to the general public. 244 people responded.
If you knew your child was going to be at risk of getting cancer, would you have gene therapy performed on them before the embryo began to develop in order to prevent cancer? 51% of people said yes, 44% said maybe or it depends, and 4.5% said no. If you knew your child was going to be at risk of being deaf, would you have gene therapy performed on them before the embryo began to develop in order to prevent the deafness? 47% of the people said yes, 34% said maybe or it depends, and 18% said no. Would you choose your child's gender? 89% said no. We also asked if people would choose their child's features, and 93% said no. It is important to note that of all the people surveyed that were parents, none said yes to genetically choosing their child's features. Many people who answered maybe mentioned that they would want to know how safe the procedure is and what the consequences are. Many people said gene therapy should only be used for life-threatening diseases such as cancer and not deafness.
Yeah, the ethics sort of always plays catch-up, unfortunately. I think that there are some scientists that certainly are reflective about it. I think that we tend to underestimate the potential for disagreement, so we sort of assume that everybody thinks like we do. When you start talking about genetics and changing DNA, that you really are messing with, or you're asking really big questions about what it means to be human.
All kinds of identity, all sorts of social identities, but also sort of disease categories. I think this conversation has been had around Down syndrome. I think it's been had in the context of all kinds of sort of mental so-called disorders, human growth hormone, right, height. There's lots of places, and even there have been times when we've thought, sexuality and race were things that we wanted to sort of cut out of the gene pool, right? And that was, that's not a good thing, right? So we're not as smart as we think we are. And yeah, that's why, I think that's why playing with genetics is serious.
The question is who's going to pay for that, and will insurance companies pay for that? It's beyond the scope of most individuals to pay for that. I think at this point we don't have magic bullets. We don't have things that we can do that say we're going to improve your sight for the rest of your life and now you're going to be normally sighted. What the therapies right now are mostly aiming at is prolonging the time, the length of time that a person can see, because it is so important, we think, to be able to have this visual concept of the world moving forward. It helps people, interact with the sighted world, basically.
The responses on whether or not to use gene therapy changed based on its intended use. Many people wanted to cure cancer, but less people wanted to use gene therapy to choose their child's gender. Where will we draw the line as more research is done on gene therapy? Will there be restrictions on what gene therapy is used for?